Good evening, everyone. This is Dr. Palacios, and I am here to discuss heart disease with part 2 of 5, which is the diagnosis, signs, and symptoms. In this video, I'm going to be talking about the 3 most common heart diseases that are found in the US today, which is congestive heart failure, high blood pressure or hypertension, and atherosclerosis, which can lead eventually to MI or myocardial infarction, which is a fancy word for heart attack. So before getting started, I just want to say that all the information that I'm providing here is only for educational purposes. It is not intended to treat, diagnose, or replace medical advice from your doctor. So the information here, just use it for your own personal knowledge. All right. So let's get started here. So the first heart disease to review is congestive heart failure. So yesterday we spoke about, how heart disease can be an umbrella, or at least in the past video, we discussed how heart disease is an umbrella of different kinds of conditions that affect the heart as a pump. And one of them was something called CHF, which stands for congestive heart failure. And what that is in respects to diagnosis and treatment, or at least signs and symptoms, not diagnosis, that's for another time, is the biggest symptom that you'll see with somebody with that type of problem is edema, something called fluid buildup, which means that the heart, it's getting congested, it's not pumping well, the walls of the heart are not strong enough, so it doesn't pump that much. So when it doesn't pump enough blood, then there's blood backup, which means that the body is going to end up with more and more fluids. That's going to cause changes in something called hydrostatic pressure aspect, which is more on the microscopic level of capillaries. And eventually it's going to cause fluid to build up. The most common area to see that type of edema is in the feet. That will be something called peripheral edema, which means that outside of your, the trunk is where you're starting to see more fluid buildup. And there's also pulmonary edema, which, the edema is more in the chest, in the lungs, which prevents more oxygen to go into the system. So regardless, there is edema present depending on which side of the heart is failing first. But typically when one side of the heart fails first, then the other side will catch up soon. We'll talk about, what is the pathophysiology, what is the cause of this, or what's going on, in more of the structure aspect with it. But for today, I just want to mention a little bit of the signs and symptoms. So first of all, the edema, like I mentioned, is the first sign. Another signs that you can experience are shortness of breath, because again, the chest is like getting filled with fluid and you're not getting enough oxygen to the tissues, which means that you're gonna feel more tired, you're gonna feel dizzy, you're gonna feel just more short of breath typically. And then if you, like, somebody takes a stethoscope and listens to your heart, they might also feel irregular heartbeats, and that's also included in your pulse. If you take your pulse and if you notice that it's irregular, that can also be a direct sign of congestive heart failure. There's also 4 classes of heart failure. Class 1 will be the least severe, which means that you can do your activities and you may have little to no symptoms. And then class 2, 3, and 4, the 4th will be the most severe, where even by just getting up and moving maybe about a minute, you're already experiencing shortness of breath and you can't be up already as much. For diagnosis of congestive heart failure, you cannot diagnose it just by clinical appearances. So it's not like your doctor can, you have all the symptoms and then the doctor can say, okay, I can diagnose it. Now you have congestive heart failure. It's not as easy as that is, because the diagnosis, you need an echocardiogram, which means it's an image of the heart which shows you the valves. It shows you the thickness of the wall of the heart. It shows you what else? Yeah, the size, and then something called, it also measures something called ejection fraction. So how much blood is the heart pumping, and all of those signs will be shown to be decreased or less than optimum when somebody has congestive heart failure. Okay, so that's congestive heart failure. The second disease that's also very common is high blood pressure, or in a fancy word would be hypertension. So in the past, I would say about 3 years or so, the criteria was if you had 140 over 90, in your numbers. And again, remember, 140 is the systolic pressure, that's how much the heart pumps blood out into your system. And then the diastolic, which is the bottom number, that's gonna be how strong can your heart feel the pressure of filling to the chamber before it pumps blood out into the system. So those are the two numbers, systole and diastole. So when your numbers of 140 systole over 90 diastole, that was considered to be a diagnosis of hypertension, and that will be after 3 visits to the doctor. If you had that number or higher for 3 times, then you will be diagnosed with hypertension. Today, the numbers are decreased, so the criteria is 130. Over 80 to 85, you will be considered to have hypertension, because they're trying to be more careful, more preventative, so you can start treatment sooner than later when it comes to those high numbers. So with high blood pressure, signs and symptoms, it's difficult. Some people never experience any signs or symptoms. Sometimes when the blood pressure is very high, something like 180 or 200, at the most they might feel like some chest discomfort, maybe some dizziness, and at the most maybe some shortness of breath. But it's actually rare for people to have signs or symptoms of high blood pressure. So that is why it is important to take your blood pressure regularly, especially if you're at risk of having high blood pressure. And again, if you notice that your blood pressure is in the 180s or higher, you have to get a referral, go to a hospital, see a doctor immediately, so you can be given the right medications to regulate that blood pressure as soon as you can, because it is a dangerous number. Okay. And then the last one is the most common one, the atherosclerosis, which we talked about yesterday a little bit, about how lipids can cause atherosclerosis, or at least fats in general, LDL and HDL. But again, when I speak about the pathophysiology of what causes the disease, we'll definitely dwell more into that. But with atherosclerosis, the one thing that you have to remember is, if you remember the heart, then you have some vessels, and then the the plaque like blocks the vessel from the blood going from here to the next tissue. There's a blockage, so the muscle cells, the myocytes, the muscle cells of the heart, don't get enough oxygen. So then you don't get enough. So your cardiac cells start dying off, and that's gonna cause eventually some problems with your heart, in a more macroscopic level. So one of them is, the diagnosis, not the diagnosis, but the symptom is angina pectoris. So angina means painful, and pectoris, it's in regards to the chest. And typically when, as a doctor, when you ask the patients, or what kind of pain is it, typically, and this is actually something I learned from one of my mentors, Dr. Mahfoud, shout out to you, is something called a Levine sign, which means that the patient says the pain feels like this, as if it's deep within the chest. And that can actually, that is a very, I don't know the percentage of how accurate that sign is to, angina pectoris, to the heart having some problems. But typically speaking and clinically speaking, a lot of doctors agree that, when a patient says, this is the kind of pain I feel, it's a little bit more concerning. So angina pectoris is a type of chest pain that you get when you exercise, when you are required to have more oxygen into your tissues, because that also goes to your heart, and your heart needs to pump faster if you want to exercise. So with angina pectoris, you work out a little bit, but then you have some chest pain, which goes here, typically here, and sometimes it radiates, it moves to the arm, and there are times I can also move to the jaw and even down here on the neck. So there's 3 forms of angina pectoris. One is stable, and that means that you work out, you feel the pain, but then you stop working out, and then the pain goes away. Or you can also take a medication, which is like a vasodilator, which means it makes the vessels of the heart expand, and again, that can also help prevent some tightness in the chest. The second one is called prinzmetal type of angina pectoris, and that's actually common in women, and it tends to happen at nighttime. So what this is, prinzmetal type of angina pectoris or chest pain, it means that the vessels are becoming spastic. Some people, there are times that some people don't even have problems with plaque buildup. It just happens because their vessels have a spasms, and when they spasm, they can close up and then prevent some type of it mimics basically a heart attack too. And the last one will be unstable angina, which is again chest pain that comes, it may go away, it may not go away, it may stay there. And the other thing is, you work out, it can come, you may not be working out, and it also can come. And that's obviously a severe case. So when that happens, you gotta make sure you get an attention of a doctor, perhaps go to the emergency room, so you can be analyzed accordingly to, be given a diagnosis to see if that's the heart that you're having problems with. Okay, so with that, I just want to say thank you for listening. Again, remember today's signs and symptoms. Always be careful with those. If you notice that you're experiencing any of those, feel free to contact your doctor. You can contact me as well. Again, I'm in the state of Connecticut. I do practice naturopathic medicine here, and I'll be happy to answer some questions that if you may have down there. All right, so I'll see you tomorrow for the next part, and have a good night.